Management Part 2. In data collection, make sure that you use assessment skills during every interaction you have with a resident. Every shift requires an assessment. So make sure that you visit each resident quickly to compare the status currently to that of the change of shift report. Frequency of data collection will depend on the resident's condition. And you need to be observant with every interaction you have with the resident. Guidelines of signs and symptoms to assess would be the following, but make sure that you follow parameters that are specific to the resident. It would be weight, temperature, upper and lower respiratory status, cardiac status, breast, abdomen, musculoskeletal, reproductive, genitourinary symptoms, sleep and rest patterns, appearance of their skin, mobility and exercise, their hygiene status, their mouth, body, hair, and nails, communication, sensory and perceptual, cultural and religious, and their psychological status. Many factors can interfere with one's work schedule and performance. For example, nursing assistants might bring a problem from home. You cannot take on the responsibility that belongs to the employee. Team members really need to solve their own problems. And don't feel guilty that you can't solve the problem for them, but be supportive and express genuine concern. Follow facility policies when personal problems affect work performance. Remember that you do not have a license to counsel nursing assistants. Another example would be encouraging personal responsibility in nursing assistants. It's essential that each team member perform his or her functions and responsibilities. If a nursing assistant cannot perform a task in his or her job description, then it's his or her problem, not a staff problem. If they are unable to perform a task because it's something they've never done before or they've never learned the appropriate method of doing so, then show them. Encourage nursing assistants to report problems and fulfillment of an assignment, and encourage them to help devise a solution. If necessary, the nursing assistant may require additional training, so request it. And dealing with demanding and complaining families. When collecting data, ask the family to be specific about their concerns and give examples of the things they feel are complaints. Common complaints will involve physical care. Employ the problem-solving process where you collect the data, identify the problem, and then try and correct it. Continued complaints following problem resolution may stem from family upset or guilt, so don't personalize the situation. Try to identify the unconscious issue and resolve it. If you spend time with the family, it helps you establish a rapport with them. Encourage communication and involvement. Families can sense when staff members are unhappy with each other, and this is reflected in the patient care. Develop a friendly relationship with the family, and it will help make them more understanding and in touch with the staff. Charge nurse duties are a part of the expanded role of the LPN. The charge nurse can delegate part of the ordinary role of the LPN to another LPN. But the charge nurse cannot or may not be able to delegate part of the charge nurse duties that are part of the expanded role of the charge nurse unless it is permitted by the Nurse Practice Act. Remember to always stay within the limits of your scope of practice, and as you are delegating, do not delegate an assignment that will be outside the scope of practice for the person that you are delegating to. So these are 10 supervisory commandments. In differentiating between assignment and delegation, think about it this way. Assignment is a task and delegation is a duty. A negative outlook can affect how tasks are performed. So when you're assigning, remember that assignment involves allotting tasks that are in the nursing assistant's job description. The nursing assistant cannot refuse except when they feel unqualified to accept an assignment. Nursing assistants are responsible and accountable for performing their tasks correctly, safely, and in a timely fashion. Tasks are activities that are carried out by the nurse assistants and are learned during their training. Most tasks are going to be outlined in the job description. Talking about not being able to perform a task is something that's going to come up. Someone wasn't there for an in-service, or they don't know how to follow the procedure as it was discussed earlier. Encourage the nurse assistant to be accountable for their learning and their job descriptions. No matter what task is assigned to a nurse assistant or other LPNs, as the charge nurse, you're going to be the one who is ultimately legally responsible for checking the outcomes for all assignments that are made. With delegation, this is going to allow the LPN to perform other duties with the ultimate goal of improving residential care. The authority to delegate is conferred by the LPN license. It requires the LPN charge nurse to provide the nursing assistant with the necessary information, assistance, and equipment to safely carry out the delegated duty. Delegation is not asking a nursing assistant to do something that is disliked by the LPN. Nursing assistants cannot be forced to accept the delegated duty. Benefits of delegation can increase the effectiveness and the efficiency of the LPN. It can help achieve patient outcomes in a cost-effective manner, and it can help nursing assistants improve their job skills. When looking at the legality of delegating, we look at respondeat superior. The registered nurse is ultimately responsible for the supervision of the nursing assistants. The charge nurse assists in the supervision of these healthcare workers and shares accountability with the RN for their actions. And the scope of practice for the LPN. Unlicensed assistive personnel will obtain data while caring for residents, but they don't have the nursing education to make a judgment about or to interpret that data. So the charge nurse needs to use his or her knowledge and experience to interpret data gathered by these members of the team. Your license is at stake in the matter of delegating nursing duties. So we use the nursing process in patient care and delegation. We collect data, and we do this through the change of shift report. This allows the charge nurse to collect data to determine how the work on the shift is going to be divided. So you report when you're starting your shift. It's a way to pass on pertinent data to the oncoming shift. You assess your patients. This will allow the charge nurse to note any changes in condition of the residents or discrepancies that might have occurred since report. It's important that each person develop his or her own system of data collection in order to maximize proficiency when giving report. Before assigning tasks or delegating duties to nursing assistants, take the time to plan how work is going to be distributed before every shift. When assigning and delegating tasks, don't assume that just because a task is simple, that it can automatically be delegated. Identify resident goals or outcomes, set priorities. And remember that the criteria for assigning or delegating to nursing assistants involves the right task, the right person, the right circumstance, the right direction and communication, and the right supervision. With implementation, it's necessary to monitor, assist, be available, and intervene when necessary. You have to monitor, intervene, and evaluate the job that the nursing assistant has done. Monitoring frequency will depend on the situation. But throughout all of this, the charge nurse has to be available for questions and should intervene if necessary to ensure patient safety. Evaluation involves two-way feedback. Legally, the LPN cannot delegate a task without checking the outcome. Was the task or duty performed? Was it performed safely and appropriately? And have the resident's goals been met? The nursing assistant should be given feedback regarding performance, so encourage them to offer input. If a delegation is made, it has to be evaluated. So if the task was not done, it's the nurse's responsibility to make sure that it's completed. So again, the 5 rights or 5 criteria of delegation. The right task and duty is how to divide the work among the staff. It's a nursing judgment that the charge nurse is legally liable for. All assignments have to be carefully considered. They require the right supervision, feedback, and evaluation. The National Council defines supervision as the provision of guidance or direction, evaluation, and follow-up by the licensed nurse for the accomplishment of a nursing task that's delegated. This definition is interpreted to include appropriate monitoring, intervention, and evaluation of the nursing assistant while performing the delegated task and feedback after the task is completed. The right person is a competent nursing assistant who can communicate effectively, collect basic data, safely perform non-complex nursing activities, and seek guidance when necessary. Prior to assigning and delegating, the LPN should review job descriptions, should know the nursing assistant's level of competence, because a competent nursing assistant will help the nurse provide high-quality patient care. If the nursing assistant refuses a task, that task has to be reassigned. But if this occurs, distinguish between I don't want to and I don't know how to, because the nursing assistant simply may not feel competent to perform the assigned task. The right circumstance. Assignment and delegation should not occur if the resident is unstable, the unit does not have proper equipment or supplies to safely carry out the procedure. The nursing assistant would face safety issues such as infection control. Supervision would not be adequate, and assistance from the charge nurse might not be available if needed. The LPN has to be available at all times to answer questions or give additional directions or clarification. So the right direction and communication. Inadequate communication are delegated duties that are not going to be completed as expected. It's a two-way process of communication that's required. You give specific, concise, complete directions and provide a rationale for the tasks that are assigned or delegated. State whether a report is expected and when you expect it. And be specific about the results that are expected. Nothing should ever be assumed. Always give specific and detailed instructions. And again, right supervision will include feedback, evaluation, and follow-up. So when you're directing, here's 4 C's of direction that may make it a little bit easier. So when you report at the end of your shift, use the same sequence of data for each resident. Staying in contact with the nursing assistant will provide updated information about the resident's condition. Giving clear and concise directions makes end-of-shift reporting easier. This will make it easier for the oncoming charge nurse to take notes from your report. Utilizing a standardized shift report form can actually improve patient outcomes by making sure that communication is complete, that nothing has been left out, that everything is concise, and it allows more time for patient care.